basically since medicine was instituted thousands of years ago, the approach has been a very biomedical approach. And what I mean by that is that patients are seen really as the sum of their symptoms, and there's something called a pathophysiological dysfunction going on, right? There's something in the physiology that is wrong, and that is why this patient is experiencing pain, or that is why this patient is experiencing this limitation. And what we need to do as clinicians is fix whatever is going on physically or biologically, and they'll get better. And what we're starting to realize, and what we've begun to see over the last 20 or 30 years of clinical research in this area, is that people are not just muscles and tissues, right? we're built of three components, and it requires what's called a biopsychosocial approach. So there is the biological, and that is absolutely real. If you cut yourself, you're going to feel pain. There's going to be inflammation. You're going to have bleeding. But there's also the psychosocial aspect of what's going on in every patient, and that varies from patient to patient. A good example of this is at the VA, for example, when I was there doing work with veterans in chronic pain. Patients that might have had maybe an injury that was not tied to a traumatic experience might react entirely different to a certain intervention than another patient who had the exact same injury, but his or her injury came from maybe a combat related injury or some kind of trauma. And the reason they had different outcomes was because psychologically or psychosocially, there were different factors at play. So as medicine begins to change, as we begin to plot the path to the future, if you would, of what we want healthcare to look like, we really need to shake loose of this idea of patients being the sum of their biological components or their biological pathways, and really start embracing this idea that people are multifactorial, which really just means there's the biology is at play, but we also need to address the psychological and the social and environmental factors that are affecting each one of our patients. And that is going to be different from patient A to patient B to patient C, even if they all have the exact same diagnosis, the exact same mechanism of injury. We need to look at them differently.